Morning, everybody, and welcome to Health Talk, sponsored by Providence Health and Services, Western Montana. My guest in studio today is, do you prefer Maddie or Madelyn? What do you prefer?
Either or, I'll answer to both.
Okay, we'll go Maddie. Yeah, we're kind of loose and informal here. Okay, Maddie Boyle is joining us, and she is with the Montana Neurobehavioral, one of your specialists. So basically, you're the concussion lady, right?
I am the concussion lady.
Okay, so tell me a little bit about what you do at your clinic.
Well, at our clinic as a whole, we have 7 providers that see general neurology. So we see anything from migraines to Parkinson's and everything in between neurologically associated. And then I run the Concussion Clinic that gives access to everyone to be evaluated by someone who's comfortable managing and dealing with concussions.
Now, we've heard so much in the last several years. I mean, starting with high school kids, grade school kids who are playing football, or any, contact sport, or even out on the playground, up to right now the NFL. There was a huge lawsuit in the NFL for players who had been injured, had multiple concussions and various things that stemmed from all that. So first of all, would you please describe, because we hear about it all the time, what a concussion is more than just a headache, obviously, right? So what is a concussion?
A concussion is injury to the brain that is suffered by any blow, whether it's a direct blow to the head or a whiplash mechanism where your brain kind of bounces around inside your skull. And often what happens is then neurotransmitters are released trying to protect your brain, but in turn that causes a whole host of symptoms that make us feel really crappy for a long time.
Okay, and so looking deeper into what happens there, obviously the brain is not meant to be bouncing around in there. It's very carefully set in there, by people who really knew what they were doing when they created us, So it's not meant to be bouncing around in there. So what kind of damage can happen?
There's a whole host of damage, and it can cause a whole host of symptoms. I mean, we see things like a headache, which I think people most commonly feel, but
Sure.
Lots of people suffer dizziness or confusion, memory loss, some things that definitely are very concerning and bothersome to people.
Now, could it be as serious as like convulsions, things like that?
Absolutely. If there is a serious enough blow, again, disrupting those neurotransmitters significantly, you can definitely suffer a seizure, hemorrhage, bleeding, a whole host of scary things as well.
Now, I understand that experts like yourself have come up with something called a concussion protocol, right? Where if a student or an athlete, especially we see it on the university, I'm the public address announcer at the stadium, so I see people when they get their bell rung, that's what they call it, the trainer leads them off, sits them down, goes through a number of exercises. What is that protocol? Can you share kind of some of the things that they do?
Yeah, so when they're evaluated, especially on the sideline, there's a few different standardized forms.
Now, do you ever get to do that? Do you ever get to go down on the sidelines?
Not anymore.
Oh!
I used to be an athletic trainer in my previous life.
Wow,
so
okay.
I did do it at some point, but now I just see them after the fact. But they're running them through tests including balance, memory, symptoms, and eye tracking, all sorts of different tests to assess where their brain is functioning and if there is damage that has occurred.
Right. Now, it used to be, if I remember correctly, when I was playing sports like 5,000 years ago, before they invented helmets. But anyway, well, you get your bell rung, you get your head hit, and they'll say, okay, can you tell me what day it is, what you have for breakfast? Okay, you're fine, get back in there, right? So, but that's really changed.
Yes, it's much more extensive now, and we're working towards standardizing that process too, so that the same care is being given to every athlete on the field and then throughout their recovery. So like I said, there's balance testing, eye coordination. There is some of that memory testing that goes on because we know that's affected. And the biggest thing is really talking to the athlete, especially if you know them well enough. You can tell if they're themselves or not themselves. I mean, that can change pretty quickly with a concussion, and they may not even recognize how badly they're injured.
And I think one of the things that trainers and coaches need to be really sensitive and aware of is, and especially in a very competitive situation where an athlete, whether it's male or female, is really competing for that starting spot. They want to be out on the field. They want to be contributing. And so they'll say, oh, I'm fine, coach. Put me back in. So what is the responsibility of the trainer and the coach at that point?
Oh, absolutely. If they feel that this person is not safe to return, which, initially after a concussion, that second impact syndrome is the biggest concern. Sending them back in while they're still symptomatic. And so the coach and the trainer have a responsibility to pull them from play and really make sure that they are symptom-free before returning them to play, which could be later that day or a few weeks down the road.
By the way, if you have a question, for Maddie, give us a call, 721-1290. We'll be happy to pass that question along. If maybe you've had a student that has had a concussion and maybe you have some personal experience in this sort of thing. I was reading there was one university athlete that I believe in the 2 years he had been playing, he'd had like 5 concussions. And so at that point, he said, I'm hanging it up for the year and maybe for the rest of my collegiate career. Can it be that dangerous?
Absolutely. The problem is we don't know how many concussions one brain can suffer. And so that does add up to these chronic effects that we're seeing come out, especially through the research with the NFL. And so we see permanent damage, whether it's cognitively or headaches or whatever, that are long-lasting. We just don't know what that is for one individual person. So that is important to be evaluated after every concussion.
Now, as a trainer, have you been keeping, as a former trainer, have you been keeping track of some of the advances in helmets and headgear protection?
Oh, absolutely. There's a lot of research that's definitely come a long way, even in the last couple years, not only regarding helmets, but also helping athletes strengthen their necks, their tackling techniques, various things to keep them safer on the field.
Well, because one of the things that you get a big time penalty for is leading with your head, right? Like
absolutely.
With your helmet, or spearing is what they call it, right?
Yes.
And so those rules have really advanced. Has it helped to keep people from being injured?
I think it's helped. I think anything makes a progress. I think the biggest thing that has helped is the research and allowing the public to be more knowledgeable about how serious concussions can be, and the signs and symptoms, so they too can be vigilant in watching their athletes.
Okay, we've been talking a lot about football. When we come back, we'll find there's lots of other ways to, if you will, get your bell rung, whether it's falling off a ladder or, other sports. So 721-1290 is our number, 1-800-568-5309. Maddie Boyle joining us here this morning with Providence Health and Services Western Montana from her Concussion Clinic. We'll be right back with more in a moment. We are back on Health Talk, sponsored by Providence Health and Services Western Montana. My guest in studio is Maddie Boyle. She's with the Concussion Clinic there at Providence St. Patrick Hospital. It's a much cooler name, but I can say Concussion Clinic without stumbling all over myself.
That's totally fine.
Okay, we've been talking a lot about football, but there are other sports and other activities that people can get concussions, right? Like what?
Absolutely. We live in a very active community here in Missoula and around the state of Montana, and so there's lots of ways people are getting concussions. Skiing, biking. Unfortunately, we get a lot of ice and snow, so those cause car accidents as well as the inadvertent slip on your driveway. So it's not just people on the field that are suffering these concussions.
Okay, so for folks who don't have a trainer or a coach, okay,
yes.
To be able to say, you know what, I think you might have a concussion. So how can we diagnose ourselves, especially if we're alone? Maybe we slip and fall, hit the back of our head, or come around a corner and bash into a cupboard, or I do all the time. So what's the best way to tell that, this might just not just be a bump on my head, it might be a concussion?
Well, I think always erring on the side of caution when it comes to your brain is very important. But common symptoms include headache, dizziness, nausea, sensitivity to light, sound, those sorts of things. Any sort of memory loss where it just suddenly happens, especially after a fall. Those sorts of things are big red flags that something is not right.
So it sounds to me like some of the symptoms of concussion also might mimic a migraine, right?
Absolutely. In fact, we treat concussion or post-traumatic headaches very similar to migraine because that's kind of the closest thing that we understand that we can liken them to. So people with migraines might be a little bit confused initially, but usually this is a different kind of headache. It's much more prolonged and continuous than their typical migraine.
Now, you had mentioned there might be some nausea involved,
Mm-hmm.
things like that. And so for maybe a mom or a dad who is at home with the kids and they've been out roughhousing or playing, and they come in and it starts, exhibiting some symptoms, what should they do?
Well, if they feel that their kid is acting normally, but just a little not themselves, headache or those sorts of things, definitely monitoring them closely, especially in that first 24 to 48 hours. If things seem to be progressing rather quickly, they're getting worse and worse headaches, they're dizzy, they're not very responsive when you're talking to them, they're throwing up, you definitely need to get them to the emergency room immediately.
I was going to ask you about that. Is it a deal where just go to the ER, don't bother making an appointment, just come in, right?
Yes. I mean, if symptoms are progressing that rapidly, and you're concerned that there's something even more serious than a concussion going on, you definitely need to get them to the ER immediately.
What happens, Maddie, if you get a concussion, but you're a tough guy? I'm strong. I am man. You know what I mean? And you say, I'm too busy. I don't have time to go to the hospital to get evaluated for a concussion. Besides, if I do, I might have to get admitted. So how do you what do you tell people who want to play the rugged individualist with a head injury like that?
Well, concussions don't get better by pushing through it. We really have to allow our brains a period of time to rest and recover. That's the only way we know how our brains have to repair themselves. And so pushing through and being active through a concussion sometimes can be more harmful than helpful and let symptoms carry on much longer than they need to.
So let's talk about treatment. Obviously, you can't go in there and mess with the brain, I mean, physically. So what is the treatment for a concussion?
Well, unfortunately, probably the best treatment is time.
Okay.
The problem is everybody's time frame is different. Everybody's brain is different. I always tell my patients, concussions, brains don't heal like bone and skin. I can't tell you in 4 to 6 weeks you're going to be better. But rest initially is important, although we're moving to a little bit more of an active recovery, meaning
Really?
You don't have to lock yourself in a dark room for 2 weeks and hope for the best.
Rats. That would be great. No, I'm just kidding.
But a little bit more active recovery. We incorporate some physical therapy, some vestibular retraining, meaning kind of working with your balance and your eye coordination a little bit better first, and then trying to improve the headaches, whether that's through therapy, rest, or through medications.
Now, Maddie, what happens when we've done all you said? We've rested. We've taken some medication to deal with the pain. But after, is there a time period where I can reasonably expect, okay, I'm okay now. I'm back to 100%. Or is that something that only you guys can decide with the various tests that you do?
Not necessarily. We definitely facilitate and help speed that recovery, especially when it's lasting longer. The research says that for people with brains that haven't suffered multiple concussions, typically we get better in about 7 to 10 days. That's that time frame when neurotransmitters kind of go back into their normal balance and our symptoms improve. Definitely, as we age or as we suffer more concussions, then that period of time gets longer and longer and longer.
Okay, so if let's say you're advising, let's say I fell or I went around the corner and slammed into the cupboard and, oh man, I've got this horrible headache. I come to see you. You say, Peter, you got a concussion. So do I go to my boss and say, I have to stay home for X amount of days? Or can you tell the severity of a concussion to say, okay, you need to stay home for this amount of time?
It's not an exact science, but we often recommend people, especially that do very mentally fatiguing work, rest for
John's
a period
laughing
of time.
at me. Mentally fatiguing. He's barely awake when he gets here.
I knew I was going to get some for that.
Okay, all right.
But definitely need to rest and allow that brain to heal itself initially. If things seem to be going on a lot longer than that, roughly 2-week time period, then there are things that we can kind of do to encourage that along. There's definitely lots of professionals that I work with in the community to help.
Like what?
We use a lot of speech therapy. So there are speech therapists in our community that specialize in the cognitive speech therapy. So they can help kind of re-educate and retrain the parts of our brain that have kind of gotten out of whack.
That's really interesting you'd bring that up, because there are portions of our brain that do very important things that can be jumbled around. So maybe it's a little difficult to speak, or perhaps, reaching and grabbing and various motion activities that could be affected.
Absolutely, as well as recall, things that may come to our brain and we'll be able to remember a name or something we do every day much quicker than but when that damage occurs, that doesn't happen as quickly, and it's frustrating for people.
Recall what? Oh, sorry, I couldn't resist. All right, so what other things do you do in your clinic besides look at concussions? You had mentioned some other things at the beginning of the show.
Yes, so all of our practitioners see general neurology, and we do have a physician who also specializes in sleep medicine. So we treat people with migraines, multiple sclerosis, Alzheimer's, Parkinson's, ALS or Lou Gehrig's disease, as well as seizures, neuropathy, the whole gamut.
What about things like epilepsy?
Absolutely.
Okay. Now, are there some things, some of these diseases you mentioned, that could be triggered through getting a concussion?
Yes. The most common we probably see is people with severe head injuries can have seizure disorders that start after their concussions because their brains have had scarring and significant damage that disrupts that electricity in there.
Now, what's the major difference between receiving a concussion on, say, on a sports field like soccer or football, as opposed to like a car accident?
Well, depending on the severity of the car accident, concussions fall in the category of mild traumatic brain injury at this point, and then anything where you're suffering either fractures to your skull or internal bleeding or those sorts of things definitely kick up the scale to more severe traumatic brain injury. That can happen, unfortunately, on a field as well. Fortunately, we don't see it as often.
Sure. All right, we're going to come right back. Maddie Boyle joining us this morning. She's with the Concussion Clinic at Providence St. Patrick Hospital. Again, we have a few minutes left in the program. If you have a question, we'll be happy to pass it along to Maddie. Maybe you've got an experience you'd like to share about maybe your concussion or something that happened to your kids. 721-1290 is our number. We'll come right back right after this. Hey, we're back on Health Talk. 721-1290 is our number. Just a few minutes left visiting with Maddie Boyle. She's with the Concussion Clinic at Providence St. Patrick Hospital. Learned a lot here in this half hour. This is great news. So the next time I bash myself in the head,
come on over. We're happy to help you.
My favorite trick is if there is a low hanging like chandelier in the middle of the room, I will hit it every time. I just don't look up. Bam, and I'll do it several times, and I'm really good at parties. People laugh. Yeah. So basically, if we think somebody in our family has a concussion or we have a concussion, what should we do?
Well, like I said, watch for those extreme warning signs and for sure get them to the emergency room if they need to be evaluated urgently. If not, that's why we developed this concussion clinic over at the Neurology Associates, because you can call without a referral, contact our office, and we'll get you scheduled usually either the same day or the next day, as long as scheduling allows, to be able to be evaluated and hopefully make you better faster.
So let's say I just bashed my head for the fourth time on the chandelier, and I'm having a little bit of a headache, and it's not going away. So when I come in, what exactly will happen during this appointment?
Well, I'll take a very thorough history of what happened and what symptoms you're experiencing, as well as your previous history. Is this the 300th time you've hit the chandelier?
Why are you
or
just clumsy? Right.
And then a thorough neurologic evaluation. And then we'll talk about how do we make progress? Where do we need to send you, or what treatments do we need to use to try and make you better, faster, and get you back to your life?
Can we just raise the chandelier a few inches?
I think that would be a very logical solution.
No, seriously, but do you, once you've diagnosed the problem, do you look at some lifestyle factors that people have and say, might be a good idea to practice this and this and this? Or
I've offered to wrap a lot of people in bubble wrap, but nobody's taken me up on that offer yet. No, there are definitely things.
Would make for an interesting football game, wouldn't it?
Right. There's definitely things that we can do to try and prevent this from happening again. Of course, with athletes, we talk about proper training and those sorts of things, but certainly, salting driveways and driving cautiously, and especially in the snowy months.
Seatbelts?
Seatbelts, very important.
Oh, yeah.
For lots of reasons.
Yeah, because the last thing you want is to have your head say hello to your windshield, right?
Right, or anything else.
Exactly. All right. So how do we get in touch with you guys? Where are you located? Phone numbers, emails, that sort of thing.
So you just have to contact our office. We are located at 601 West Spruce Street, so conveniently right across the street from the emergency room at St. Patrick's Hospital.
Perfect.
And you just have to call our main number, 406-327-3350, and tell them you want to be seen in Concussion Clinic.
All right. So in the minute we have remaining, Maddie, tell me what you love about your job. When your feet hit the floor in the morning, I can't wait to get to work. Why is that?
I really love the people and the patients I work with. I get to see people and help them through some of their more trying times in life, and I think that is a privilege for all of us in medicine.
So when someone comes to you and they've completed their protocol, does anybody ever come back and say, thanks, you guys did a great job for me?
I have had people come back and relieved to get back to their life and feeling better and seeing how far that they've come.
And they're glad they came.
Absolutely.
Yeah, they're glad they didn't ignore it and hope it would just go away by itself.
Right.
Because oftentimes it won't.
Correct.
All right.
Unfortunately.
Maddie Boyle, thank you so much.
Thank you. Thanks for having me.
Being on the show today on Health Talk. And that's going to do it for this week. Health Talk sponsored by Providence Health and Services in Western Montana. We're going to come right back after the top of the hour, and we'll have Talk Back. Open phones right here at 721-1290. We'll be right back.